When you do that together, you can diagnose, treat, and follow with the same methodology, which is really, really great for patients.
What exactly is Theranostics medicine?
Well, Theranostics is an old concept that is actually being modernized. Let me explain. Theranostics literally means therapy diagnostics in one. Today, when you refer to a Theranostics procedure, it's something that includes imaging. That's the diagnostics part, Theranostics, therapy diagnostics. When you do a diagnostic test that shows you exactly where your target is, and then you follow that test with a therapy, that's when you have Theranostics. If you want to break this down in little pieces, you're talking about a biomarker-guided therapy. Let's talk about PSMA Theranostics. Basically, you have a PSMA, prostate-specific membrane antigen, that is overexpressed in the surface of these prostate cancer cells to a level that is up to 1,000 times higher than a normal cell. You have that target, and the molecule that you're designing to bind that PSMA receptor is labeled with a diagnostic isotope, in this case F18, gallium 68, copper 64. I mean, you can diagnostic zirconium. I mean, you can just have plenty different isotopes. The idea is it's telling you where the disease is, how much disease do you have, and exactly it's going to help us to decide what we're going to do next. Because if I do one of those diagnostic tests and we find one or two lesions, we're going to do something different. If we find lesion, this uptake only in the target organ, let's say like the prostate, you're going to do something different. If you have multiple metastases, then you need to do something different. The idea is precision medicine, right? How do we find the right therapy for the right patient at the right time? So going back to Theranostics, you have a molecule that is bound to a isotope that is the diagnostics. You go there, binds the surface of that cancer cell, then you exchange that isotope with a therapeutic isotope, and then you deliver a therapy that is really treating the cancer and not treating normal cells. In the past, we have used a lot of guesswork, right? We have said, we're going to give you this therapy, come back in 3 months, and we'll figure out if it's working or not. Now, with this new technology, you can select the right patient because it lights up with this test. And then you not only have to have the ability of select the patient, you actually can see the therapy when it is done, because the actual therapeutic isotope also has some sense-on information that we can capture and actually make an image of, and we do that with post-therapeutic exams. When you do that together, you can diagnose, treat, and follow with the same methodology, which is really, really great for patients. And the patient's outcomes are going to be a lot better because we're going to select the right patient, we're going to do the right treatments. So there are several publications out there, but one of the publications, and now we can put it on the chat here, but it says that if you have aggressive prostate cancer, doing a PSMA PET-CT, which is telling you where the cancer is, changes the management for that specific patient up to 62% of the time. That means that if a urologist send this patient for imaging and he was thinking I'm going to do surgery. And he comes after the pictures and sees that this patient has disease everywhere. Oh, I'm not going to do surgery anymore. I mean, if I do surgery now, I'm hurting that patient, right? Because I'm not going to take the disease away, and he's actually will benefit better from another intervention. At the same time, some patients that they had a decision, hey, this patient cannot be treated, to see how he's doing, and they have a older generation imaging, and they show with the PSMA PET-CT that the disease is actually localized just to the prostate. So you will say, okay, we can do something here. The point is that the least chances for you as a physician to have to guess on a patient, if you lower those chances, you have better outcomes for patients. And that is, in my mind, the best message Theranostics. And we're talking about precision, and we're talking about inclusion, where you have all the pillars of oncology working together. You have the medical oncologist, the urologist, radiation oncologist, and the nuclear oncologists and imagers working together. And you can expand that to the physicists, the technicians, the nursing. I mean, you have a true community, all in one accord to help patients. That's why I'm excited about Theranostics.